Adlaw sa tanan, I'm Dr. Casey Tisorio-Mir, and I was asked to talk about COVID-19 vaccination for teenagers today. Coronavirus disease 19 has been affecting our country and the whole world since 2020. Globally, over 200 million confirmed cases of COVID-19 have been reported. As of December 1, 2021, the total number of active cases in the Philippines is 15,327. 2 million Filipinos have already recovered, but 48,000 have died. Gamay ra paminawon ang 1.72% death rate. Pero para sa mga kapamilya na namatyan tungod sa COVID-19, dili jud lalim. In April 2020, cases of multisystem inflammatory syndrome in children, which is a rare complication that typically happens 2 to 6 weeks after SARS-CoV-2 infection, have been reported. The child exhibits symptoms such as fever without an obvious cause after having COVID-19 or after being exposed to someone who had the disease. Makita nato sa picture na nanglagom in town ang bata. 60 to 70% of patients are admitted to the ICU and 1 to 2% of children mga matay jud. Luoy kaayo. Is there a cure for COVID-19? Almost 2 years since the start of the pandemic, there are still ongoing clinical trials and studies on which medications are effective against COVID-19 disease. The current medications given to COVID-19 patients are still part of an ongoing clinical trial. For sure, naapod mga mama bears, parehas na ako nga nasa audience today. We want to make sure our children are safe all the time. And since wala pa man jud tambal ang COVID, prevention is still better than cure. Giabisuhan sa DOH ang publiko nga magsuot og mask, especially kung mugawas sa balay. Tabuni ang baba ug ilong gamit ang panyo or tissue. Kung wala kay panyo or tissue, ibawog ang imong siko aron matabunan ang baba ug ilong inig ubo ug hatsi nimo. Permiso dapat ka manghugas og tarong sa imong mga kamot, at least 4 times a day, especially if gikan ka sa gawas. The new COVID-19 variants are now airborne. So magpalayo ta sa mga tao kung muubo or hatsi. Mas nindot kung maglikay kita og mga lugar na walay nindot na ventilation. Mas maayo dito ta sa open air. Or kung aha makagawa sulod ra ang hangin. Last and most importantly, I encourage everyone to get vaccinated, which I will discuss further this morning. So, how do vaccines prevent disease? Vaccines mimic the virus or bacteria that causes disease and triggers the body's creation of antibodies. Daghan na kay ni pasyente na nangutanan ako og niingon na, COVID man lagi gihapon to siya, dok. Nabakunahan man to siya. It's true na if mabakunahan ta, pwede gihapon ta ma-COVID, pero ang uban ana asymptomatic lang jud og mild. Kay nganuman, the antibodies that we get from the vaccines will provide protection once a person is infected with the actual disease-causing virus or bacteria. Based on data from Metro Manila hospitals dated March to November 7, 9 out of 10 people who died of COVID-19 were unvaccinated. It is provided for by the government and it's free. So as of November 30, 2021, there have been 5 million Filipinos who have been vaccinated against COVID-19. The Center for Disease Control and Prevention, or CDC, recommends Pfizer or BioNTech vaccine for children ages 12 to 15 years old. The vaccine has an estimated efficacy of 100% in preventing severe COVID-19 disease. Minors need their guardian and or their parents with them during vaccination. Dili mo dawaton sa vaccination site kung dili nimo kuyog imong mga ginikanan. Once your family has decided, talk to your child before vaccination about what to expect. It is not recommended that you give pain relievers before vaccination to try to prevent side effects. Once you arrive at the vaccine center, you will be registered. Naimutabang nimo ng mga volunteers, mga barangay health workers, o mga DOH personnel. Pre-vaccine health education will be given where you can ask any questions you have about the vaccine. Mangayo sad og informed consent. Then, you will be screened for risk factors. It's important to tell the doctor or nurse about any allergies your child may have. If ang imo anak na ay HIV, na ay cancer, na ay organ transplant sa una, nag-take og steroids, ug bedridden, kinahanglan na sa vaccine center ang medical clearance before siya mabakunahan. The vaccine administration only takes around 1 to 2 minutes. To prevent fainting and injuries related to fainting, your child should be seated or lying down during vaccination and for 15 minutes after the vaccine is given. After your child's COVID-19 vaccination, you will be asked to stay for 15 to 30 minutes so your child can be observed in case they have a severe allergic reaction and need immediate treatment. So, palihog, ayaw jud lakaw dayon ha? What are the common side effects after vaccination? 90% are mild to moderate. Sa iyang bukton, makabantay unya siya na musakit or muhubag ang injection site. Ang uban pasyente, hilantan, mulabad ang ulo, sakit ang lawas, mag-chills, ug ang uban kasukaon. Ayaw lang mo kaguol, kay expected na side effect. Side effects are most common after the second dose. What to do after vaccination? Take paracetamol if nakay mga symptoms. Sleep well at least 8 hours a day. So, ang mga teenagers nato, di lang sa mag-TikTok, okay? Tuog lang sa jud og tarong. 8 hours pa jud ha? Dili na putol-putol, straight. Eat balanced meals. Dili pwede magutman, di pwede mapasmo, especially if gikan na bakunahan. To help the immune system make antibodies against the SARS-CoV-2 virus. What if symptoms become severe? Call the healthcare provider where you were vaccinated. It should be indicated in your post-vaccination card. DOH personnel, affiliates, and volunteer doctors will monitor you for surveillance. So, dili ra ka, of course, pasagdan. Nagsugod na sa Manila o sa Cebu na magbakuna sa mga teenagers. As a parent and as a doctor myself, the benefits of vaccination far outweigh the risk. So, ayun na mo pagduha-duha o paglangay-langay pa. These are my references. Salamat kaayo sa inyong pagpaminaw ug mag-amping tang tanan.